Meanwhile, elsewhere, the UK recorded over 92,000 new infections on Friday, and authorities there are working around the clock to contain the latest resurgence driven by Omicron. Now, for more, I have David Cox live on the line. David, it's a pleasure to have you back.
Sunny, thanks for having me on the show.
Right, let's begin then with a few words on the current COVID-19 situation there, David.
So the landscape has unfortunately changed quite a lot in the last few weeks. So as you say, the number of daily cases has just really spiraled in the past week. And Boris Johnson is basically trying to tackle this by basically getting as much of the population to receive a booster vaccine by the end of December as possible. The key thing here at the moment is that while we know that Omicron is very much more infectious than anything which has come before with COVID-19, we don't know whether it's more severe. So we're still waiting to see whether the number of hospitalizations and deaths will also go up in the coming weeks. So it's still a little bit of a matter of wait and see right now.
Right. Meanwhile, in response, though, on Saturday, David, I believe London Mayor Sadiq Khan declared a major incident in the city. What does this declaration mean?
So the big thing is that SAGE Group, which is the group of scientists who advise the government, they have suggested that without current interventions, so without more restrictions, the hospital admissions could reach 3,000 a day in January, which has concerned a lot of people. But this is the worst case scenario. So at the moment, we're still not seeing hospitalizations going up significantly. But if that does happen, as some scientists have forecast in the next month, then we could see much more severe restrictions and potentially another lockdown.
I see. Meanwhile, Dr. Kim, given global concerns over Omicron, there appears to be growing interest in the potential impact of COVID-19 pills on the battle against the pandemic. What are your thoughts on this?
Well, there are just two drugs that are actually being just discussed right now. The first one is a Merck drug, and then the second one is a Pfizer drug. And unfortunately, the Merck drug, based on their interim analysis of phase 3 clinical trials, they show the 50% of efficacy of inhibiting progression into the severe COVID-19, and then there was no death. But actually, based on their final report of the phase 3 clinical trials, the final efficacy was actually recorded as 30%, which is a little bit disappointing. In the case of the Pfizer drug, the Pfizer drug has actually completed the phase 3 clinical trials. And then even after phase 3 the end of the phase 3 clinical trial, they still just show the 89% of efficacy, which is actually inhibiting just the progression into the severe COVID-19. So just in terms of preventing the severe COVID-19, the Pfizer drug seems to be very effective. And then regarding the Omicron variant, not all, but most of the mutations found in the Omicron is actually identified in the spike protein. And the spike protein, this is actually the main target of most of the vaccine development and the monoclonal antibodies. So maybe vaccine efficacy and then monoclonal antibody efficacy might be substantially just affected by these mutations found in the Omicron. And then we are actually observing some of the very negative effect on the monoclonal antibodies and the vaccine as already. But in the case of this Merck drug and the Pfizer drug, there actually the antiviral mechanism of action is very different from those of monoclonal antibodies. Monoclonal antibodies is actually targeting the spike protein, but the Merck drug actually just targeting sort of just RNA-dependent RNA polymerase, which is actually involved in the viral genome replication. And then the Pfizer drug is actually just targeting some viral protease, which is actually involved in some processing of a viral polyprotein. So basically, just targeting just a protein of these two oral antiviral drugs is quite different from the other medications so far. And then theoretically, the Omicron would not be just effect at all for the antiviral efficacy of those two antiviral drugs. And then in part, the Pfizer actually announced that their drug, the Paxlovid, is not affected by the mutations found in the Omicron, at least based on their cell culture experiments. And I think that there is no substantial effect on the antiviral efficacy of these two oral drugs by the mutations found in the Omicron.
Right. Right. And staying with COVID-19 treatment pills, David, last month the UK became the first country to approve molnupiravir. And I hear there is a study being led by Oxford University on its efficacy as we speak. Could you tell us a bit more about this study?
So the whole idea behind it is basically to see whether this drug can prevent more vulnerable patients, so like the over 50s and patients of underlying health conditions needing hospital treatment. So this drug, the idea behind it is that there has been data which shows that it can reduce the likelihood of being admitted to hospital with COVID-19 by 90%. So this clinical trial wants to see whether that truly is the case, because there has been some other data which shows that it could be a little bit lower. But the whole thing is that scientists are saying that even if it just reduces the severity of COVID in those vulnerable populations by a little bit, that would still be a very valuable benefit. But that whole idea of the trial is just to see just how effective it is.
Right. David, the UK Health Minister Sajid Javid has left open the possibility of a circuit breaker, even ahead of Christmas, which would be this Saturday. What are the prospects of such a scenario, and how do you expect the public will respond to a circuit breaker?
Well, I think most people in the UK are opposed to the most severe restrictions, so a full lockdown. But I think people would support more like smaller measures. So, for example, reintroducing social distancing in hospitality venues. I think we have to see what will happen. It's really hard to predict. But the Prime Minister, Boris Johnson, has repeatedly said he is opposed to a full lockdown. And I think there's like a lot of members of Parliament who also are like on the case. I think what is more likely to happen in the coming days is that we will see some moderate restrictions reintroduced. So perhaps like limiting the amount of households who can mix at Christmas. But I don't think we're going to see anything as drastic as a full lockdown, maybe until the new year, perhaps.
David, current restrictions in place do include a mask mandate, right? Could you tell us a bit about that?
Yes, so at the moment we have to wear face masks in all indoor venues. There's also COVID vaccine passes, and over the past week people have been told to work from home again. So these are some restrictions which we haven't had in the UK since May, June time. So it has been quite a game changer for people, the rise of Omicron. And yeah, it just remains to be seen whether we're going to have even more restrictions to come.
All right, David, as always, thank you very much for your time and your thoughts at this hour.
Thank you.